Welcome back to Hospital Business Buzz. Today is 31st March 2026, and we are closing out Q1 with a massive shift in how hospitals operate. If you are still treating AI as a pilot project, you are already behind. Today's top stories. 1. AI implementation reality. 97% of healthcare professionals now agree AI must support, not replace, clinical expertise, according to a new Carta Healthcare survey. 2. Administrative shake-up in India. Medical bodies are pushing back hard against appointing administrative officers in government hospitals, prioritizing clinician-led governance. 3. Financial resilience. Despite high inflation, listed hospital chains in India are reporting a robust 16 to 18% revenue growth for FY26. 4. Virtual hospital growth. We are officially entering the virtual hospital era, moving beyond telehealth into total home-based care models. Segment 1. The 2026 AI Infrastructure Mandate. Let's dive into AI. The narrative has shifted from AI hype to AI infrastructure. According to reports from the 2026 JP Morgan Healthcare Conference, AI is now being integrated into daily workflows to fortify balance sheets. Times ambient scribing, it's no longer just a luxury. AI scribes are reducing documentation time by 20% plus, restoring joy to medicine. Times Revenue Cycle Management, RCM St. Luke's Health System reported a $13,000 reimbursement increase per clinician using AI-driven coding reviews. Times The actionable AI trend, diagnostics are moving from listing numbers to predictive roadmaps, especially in Indian diagnostics where quality consolidation is dominating. Segment 2, Hospital Financials and M&A. Q1 2026 update. How did the big players do in Q1 2026? Times Global Health, Medanta reported robust Q1 results with a 19% revenue increase and 23% EBITDA growth, driven by higher patient volumes and improved realization. Times Fortis Healthcare reported 16.6% consolidated revenue growth, with their hospital business growing at 18.6% YoY. Times Jupiter Lifeline Hospitals saw a 20.5% year-on-year increase in total income. Times The Trend, hospital sector EBITDA margins remain stable at 23%, very healthy due to ARPOB, average revenue per occupied bed, gains and increased operating efficiency. Times M&A Focus, we are seeing a Buy India push, with large private equity players looking to acquire mature hospital assets. Segment 3, Workforce, Governance and the Human Factor. While technology scales, the human element is facing challenges. Times The Indian governance fight, major medical bodies, TTGDA, HRDA, are opposing the appointment of non-clinical administrative officers in government hospitals. They argue that hospital administration is a specialized discipline requiring clinical knowledge, not just management expertise. Times Workforce Shortage, by 2030, a 18 million worker shortage is predicted globally. Times The Solution, hospitals are focusing on flexible scheduling, mental health support, and AI to relieve the burden, not just replacing them, which is helping improve employee retention. Segment 4, Emerging Trends, Robotic Blood Drawing and Smart Toilets. Looking at the cutting edge. Times Robotic Phlebotomy, robots like Vitestro are now in action, finding veins via ultrasound to draw blood with high accuracy. This could change laboratory diagnostics entirely. Times Digital Twins and Smart Toilets, we are seeing the rise of AI-powered virtual replicas of patients, digital twins, and smart toilets to provide real-time internal organ diagnostics. Times longevity packages. Hospitals are shifting from sick care to proactive longevity services, offering concierge-style membership-based care. Conclusion and takeaway. Final thoughts for the day. 1. AI isn't coming, it's here. Invest in RCM and Scribe AI. 2. Finance is strong, but patient mix is changing. Value-based care is becoming mainstream. 3. Governance matters. Maintain clinical oversight in administration. That's all for today's Hospital Business Buzz. Don't forget to like, subscribe, and hit the notification bell for the latest in health, tech and business. I'm your host, Dr. G. Singh. See you next time. CTA, which of these trends will have a major impact on patient care this year? Let us know in the comments. Subscribe to my channel for more. Disclaimer: the information must be verified before use. The creator, publisher and YouTube will not be liable for any negative consequences.